Hello, my name is Dr. Kelly Lee. I'm a BPS chartered psychologist and the founder of the Dementia Care Hub, which is a charity that exists to try and help people living with dementia make life a little bit better. So today I'm in a conversation with Dr. Kate Howe. She's a postdoctoral research fellow at the University of Southampton, and you work in the Centre of Biological Sciences. Is that correct?
Yes. Well, my desk is within biological sciences, and that's where I've been based for the time that I've been here, which is quite a long time. But also technically part of Enterprise, which is a sort of side school of engineering.
Okay.
That's just technicality.
Okay. So obviously we're talking about dementia and we're talking about hearing impairment and dementia. So how does your research encompass dementia? Where's the interest in that for you?
So my research area is looking at the sort of biology or immunology of hearing loss and how different events throughout our lives impact our hearing trajectory and sort of the biological mechanisms of that. So we're very interested in kind of hearing across the lifespan, but particularly towards the middle and later half of our lives, and how that kind of changes and how that's linked to other health conditions. And particularly we're interested in sort of neurodegenerative diseases such as Alzheimer's and dementia. So we've been doing a lot of work over the last 18 months where we've been trying to actually raise awareness of the links between hearing and dementia, and I'll go into those in a bit shortly. But yeah, we've been going out into our local community to try and raise awareness and tell people that hearing loss and dementia are linked, and there are things that we can do to sort of improve both our hearing and our brain health. So I've been trying to sort of let people know what they can do to help their hearing health and their brain health.
Okay, so this seems like a really good opportunity then to come in with that, because the people that will be watching this will be interested in, how this can help them, what this might do for them. So do you have any sort of tips for, this brain health and what people can do?
So with regards to hearing loss, we know that there are 12 modifiable risk factors for dementia, and these include things like smoking and physical inactivity, and hearing impairment is one of them. But importantly, it's unaddressed or undiagnosed hearing loss or hearing impairment. So that's thought to be the biggest modifiable risk factor. So that's why we're encouraging people to think about their hearing when they're trying to think about sort of improving their brain health. And some tips, well, one huge tip is for when people reach midlife or older, they should get regular hearing tests. And I know a lot of people don't get regular hearing tests, not in the same way that we kind of get our eyes tested regularly, and we're so, on top of that, most people. So a big tip would be to, go to your GP and say, I think it's time that I have a hearing test. And they will refer you to audiology, and these usually are at the hospital. So you go to the audiology department and you'll have a hearing test. And if they identify that you have a hearing loss, and there's different types, so you can have mild, moderate, severe to profound. And if a hearing loss is identified, then they will recommend that you get a hearing aid. And the second big tip is that if you're recommended to wear hearing aids, then you should do your best to actually wear them. And they do take some time to get used to. So when you first get them, you might feel that everything sounds a bit weird and sounds that you don't necessarily want to hear as much. So your footsteps or some tapping noises that you might not have heard before, they might start to bug you, and you might think that you don't want to wear the hearing aids as much, but you need to let your brain have time to adapt to the hearing aids. So it's really important that if you are prescribed hearing aids, that you do start to wear them, and you try and wear them as much as possible to give your brain a chance to get used to them. And over time, they'll become something that you don't really think about, and they won't bother you as much. And we know from research that if we have hearing loss, and if it's addressed with different hearing interventions, so these are hearing aids and also cochlear implants, which is another area of my research, that if we address hearing loss with these hearing interventions, that will slow down cognitive decline, and that can reduce the risk of dementia in people that are at a higher risk. So yeah, so top tip would be to get hearing tests, and then if you're prescribed hearing aids, then to wear them as much as possible.
So a couple of questions that were coming up while you were talking then. One, like we see on TV and stuff, like Specsavers, there are other opticians out there. But Specsavers, for example, they've done quite a big kind of campaign in terms of come get your eyes tested. Oh, actually, come to us to get your ears checked.
Yeah.
And I guess in the current climate, when it's difficult to get an appointment that's urgent, as opposed to one that is a nice to have, that's quite difficult. And also then, going to the doctors, getting an appointment, then getting a referral to the hospital, then getting to the hospital, paying for the parking, walking. There's quite a few, I can identify quite a few barriers there before I've even started. And so that in itself can be problematic in terms of, one, we're not identifying that we should. So for example, I should really be on the phone to my doctor after this conversation saying, can I get a hearing test?
Yeah.
Because I would say that I'm in my midlife.
Yeah.
And for it to become something that's normalized for me, I kind of really need to start doing it now.
Yeah.
Chances of me doing that are unlikely.
Yeah. So there are some things that you can do sort of before those steps that I said. So for example, there are some different online, let's call them hearing checks. So they're not a proper test, but they're a hearing check or a screen. So one of them is on the RNID website. So you can go online, and they've got these simple hearing checks.
What website, sorry?
RNID.
What does that stand for?
It's the National Hearing Charity. I can't remember the acronym.
Okay.
And there's different ones as well, also on the World Health Organization website. There's different, if you just type in online hearing checks, and you can do it at home, and you can just sort of test your hearing at home. And then if this identifies that you might have a problem, then on the RNID one, it will give you a certificate which you could then take to your GP. So you can kind of do a first pass check at home to see whether, if you think there might be problems and then the test says there might be problems, then it would be a good thing to actually try it as hard as possible to get to your GP. But you can do some checks and then kind of just keep on top of it to see whether you think, if the test online says that it doesn't really identify any problems, then maybe you can do it again in a year's time. So that's something that you can do at home.
Okay.
And with regards to going to the high street places, so Specsavers, Boots and places like that, that is a good way to get an initial test. And a lot of them now do tests for free for people over a certain age, and I think some places do them free for all ages. So you'd have to I'm not going to say who because I'm not quite sure, but if you just have a look online, you can then sort of get an appointment probably much quicker than going through your GP to get a hearing test in these places. And then when they do the test, then you can ask them to give you your results. So the test will give, the sort of outcome of the test is what's called an audiogram. And this is just some numbers, and it gives you, an overview of your hearing abilities. And if you ask them, a copy of your audiogram, so your own numbers, and there's a big campaign at the moment called Know Your Number, and it's about people being empowered to know what their hearing status is. So if you go to those places, get a hearing test and ask for your audiogram and get your results, and then you can either go through them to sort of explore hearing aid options, and obviously those will then need to be paid for rather than if you went through the NHS. Or you could then use that data and the test to sort of get fast tracked by the GP by saying, I've had a hearing test in Boots and they've identified that I have a hearing loss. I need to now go to audiology, please, because I want to get hearing aids through the NHS, and therefore you won't have to pay for them. So there are some other options as well.
Okay, so getting your hearing tested midlife is kind of key. How does that impact at all in terms of dementia?
So we know that hearing loss and dementia are linked, but we don't know exactly what the mechanisms are. But there are different mechanisms that have been proposed in the sort of academic literature. And one of them is to do with the sort of social aspects of hearing. So if you have a hearing loss, and this can lead to communication challenges, someone might withdraw from their networks. This might lead to social isolation and loneliness. And those two are both risk factors for dementia as well. So you can see how they're all kind of linked. So that's the sort of social aspect. Another proposed mechanism is that when you have a hearing loss, it causes sort of the functioning of your brain then has to work harder for the hearing side of things, and then therefore less of the sort of brain energy, as we say, can then be used for sort of retaining and receiving memories. So it's kind of taking the brain energy and using it for the hearing, because there's a hearing loss, and it's taking it away from the sort of brain functions that are associated with dementia. So there's a couple of kind of reasons there of how they're linked, but we don't know the exact cause, but we do know that they are linked.
So I guess from the perspective of the Dementia Care Hub and people that are, you know, members and engaged in the Dementia Care Hub, you know, they are living with dementia. So you've got people that are living with dementia themselves, they're diagnosed or undiagnosed, but they have symptoms that are aligned with a dementia of some sort, and also families of people living with dementia.
Yeah.
So, you know, once you have dementia, it can be quite an isolating and lonely experience in itself. People will say, my partner won't wear their hearing aids, or and not that dementia is just about memory loss, because it isn't, but it's remembering to put them in, it's remembering where you've put them, you know, and sometimes they're these kind of small things, you know, or they can be uncomfortable, or they can, you know, so I guess there are so many barriers there in terms of making sure you know where they are, making sure that somebody is wearing them, making sure that not only do they wear them, but they keep them in. And I guess this kind of stuff has to be familiar, you know, which again goes back to the earlier you start wearing them, the better. But equally, you're only going to wear them if you need them.
So there's lots of challenges around, you know, different hearing interventions for people living with dementia, and also for their carers. And as you say, the earlier that you start wearing the hearing aids, the more familiar you are with the items. And this is particularly important for people with dementia, because, well, we know from research that there's a sort of 10-year delay in when people first identify that they might have a hearing loss and when they first get hearing aids. So there's a big sort of time difference there. So if people did get their hearing loss identified earlier and start to wear hearing aids earlier, then they'll be more familiar with them. So then this will help sort of later on in life when they might develop other health conditions. And we know that there's other health conditions, not just dementia, that makes wearing hearing aids more challenging. So things like, you know, with dexterity in your fingers and changing the batteries and remembering to wear them. So it would be good to get them as early as possible, but obviously that's not always the case. And for some people who have dementia and hearing loss, they really might not get on well with hearing aids, and that's completely understandable. And there are other sort of other listening devices that are available. So you can get, they're called personal listeners, and they kind of look like old school MP3 players. So they've got headphones, and then they're just attached to sort of a box which has got the microphone in it, and people can just wear them over their ears while they're watching the TV, or while they're sitting with their partner, or if they're with the doctor. And it just helps communication in those specific environments. And they're kind of they're not as small, they're a bit easier to kind of wear, a bit more comfortable. So they can be something for people that have dementia and hearing loss. And a lot of people aren't aware that you can get them, and you can get these through social services. So as long as your hearing loss has been diagnosed, then this should be something that can be offered for you, to support you if hearing aids aren't possible.
I also remember reading one of the books that Wendy Mitchell has written, who is a woman who is living with dementia, and you know, she's amazing. She's been all over the world talking about her experiences and you know, really trying to get people to see it from her perspective and understand what it is like to live with dementia. And she mentioned that she found it really difficult when sort of waiting at train stations and stuff, the screeching of trains and all the, you know, I mean, they're noisy places, aren't they? Just the train itself, the way that the door opens, the way that they move, everything about them. And she went to an audiology department and she had something that actually made all of that better. So she could wear a hearing aid of some kind, which enabled her to live better with dementia, because those noises that once she could, you know, before dementia she could tolerate, living with dementia she could no longer tolerate those noises, you know. So and people don't know this stuff, you know, generally people don't know. It's something that, oh God, I can't do that anymore, so therefore I won't go on a train.
No, definitely. And I think also with hearing aids, a lot of people associate them with maybe what they were like 10, 15 years ago, and you know, with the excess whistling and the largeness of them, and or the, you know, just, but the technology has improved a lot over the years, and things like that where they can now, there's sort of put specific settings on to shut out these noises that may be, you know, completely impossible for someone living with dementia. So yeah, it's kind of in raising awareness of that, and that hearing aids just aren't a one standard thing, that, you know, they can be adapted to fit you, and they can help you if you are working with an audiologist and you kind of seek that help.
So I guess really it's about one, getting your hearing tested earlier.
Yeah.
But bearing in mind that majority of us probably won't do that. But that's not, I don't mean that. But you know, we're supposed to create, you know, supposed to write wills. We're supposed to do all this really important thing that we actually really don't get round to doing until we really need to do it, kind of thing. That's the gold standard. If we could all be doing that, that would be fantastic. But we do have a lot of people, you know, 900,000 estimated living with dementia currently at the moment. It's probably more than that. Not everyone wants a diagnosis, and rightly so. But people that are living with dementia right now, you know, so I guess it's also important to know that there are some things out there that may be helpful, but it's also, I guess, about planning around that appointment, you know, because hospitals can be quite confusing places, and all the movement going on, or, you know, generally you go into hospital, your anxiety is increased just by being in a hospital environment, really. So, and knowing that anxiety and dementia kind of pretty much go hand in hand in terms, you know, the brain not functioning in the way that it was, and therefore the fight and flight mechanism kicks in a lot of the time. So if we want people to go and get their hearing health checked, or, you know, just look at how can this be the best it can be, living with dementia, you know, is that then go to your GP and ask to be referred, just to make sure that everything is as good as it can be.
Definitely. I think that would really help, and ensure that there's, you know, all of the, because obviously hearing loss changes over time, and can change quite rapidly for some people, and the same with cognitive decline. So it's really important to kind of, for your understanding of your own hearing health to be up to date, so then you know what different things could help, and what different technologies or services that you could have access to. So I think that is really important, and there's a, you know, we've got a lot of work to do in terms of making clinicians and GPs and making hospitals more deaf aware, and making environments more suitable for people as well, for living with dementia and with hearing loss. So there's a lot of work to be done in terms of reducing the barriers, and that's some of the stuff that we've been working on and doing research about. But yeah, in the meantime, I'm doing my best to go around.
So what is your mission, Kate? You know, what do you want to achieve, and how are you going to achieve that?
So my mission at the moment is, as I said, to get the message out to as many people as possible about these links between hearing and brain health. And because, you know, a lot of people don't think about it, but there are things that you can do for your hearing, and also for communication, which I haven't mentioned, but we'll go into that in a minute. But there are things that can be done to help your brain health and also your overall health and well-being. So my mission is to go into the local community in and around this area to raise awareness of those links and highlight the things that people can do, and also just to start encouraging conversations about hearing and brain health, because they're both quite stigmatized topics. They're not things that people like to talk about. So I've been doing a community engagement project over the last year where I've been going to different or trying to link up with different community groups, and that's how I met you, and visiting different communities and groups, trying to build trust and relationships with them, and then start these conversations about hearing and brain health, and hopefully empower people to kind of take it into their own hands and make some small changes that can improve their overall health and well-being. So that's my mission.
So just finally, you mentioned there about communication.
Yeah, so just sort of going back to tips for people, and I know as we've talked about, there's lots of barriers to actually seeking hearing healthcare, which we have discussed. But in terms of, when communicating with someone with hearing loss and also with dementia, there are small things that you can do. So making sure that you've got that person's attention before you start speaking to them. So I've spoken to a lot of people in this situation, and they say they never listen, and I said, are you in the kitchen while they're in the living room and you trying to shout into them? And they're living with hearing loss and they're living with dementia. So just small things like making sure you tap them on the shoulder or you get their attention so they can see your face while you're speaking. So we all rely on visual cues, lip reading. So if someone doesn't have that, then obviously it makes communication more challenging. So there's, small things like that, making sure they can see you, making sure that when you visit someone who's living with dementia and has hearing loss, that the TV isn't on 100%, and you're not trying to talk over the TV or the radio, and then everyone gets a bit more, agitated because they can't communicate properly. So just making sure the environment is as quiet as possible and that you can see each other, and, those small things can actually really help, and they kind of just take away a bit of the frustration maybe that comes with communication challenges.
Quite interesting, isn't it, how it's often, we talk about the small stuff that makes a massive difference, and it kind of is. I mean, if you think of, when we were living through the COVID pandemic and masks were being worn, I mean, communication wise, that was pretty tricky in terms of reading somebody's face, in terms of being able to know who's talking.
Even judging someone's expression, knowing whether someone is saying something and they're happy about it or they're sad about it, it kind of takes all that away. And I think it made us all realize that how much we rely on, as I said, on visual cues, and not just people who have hearing problems, that they rely on lip reading. We all do, and we all found communication more difficult. So I think just being more deaf aware and being more aware of those things that we can all do to help other people. We don't know what someone's hearing's like, or we don't know what someone's cognition is like. So just being kind of mindful of those small things would really help.
And I guess, to finish off, this means that if we follow some of the tips that you've given us in terms of checking our hearing health, making that a priority, but also, doing those things in terms of communication, making sure that you are present and engaging with the person, then that enables them the ability to engage, or certainly gives them a better chance of being able to do that.
Exactly, yeah. And then that in itself can improve sort of quality of life, well-being
for both people as well, isn't it? Because it's it's that kind of conversation is a two-way thing. So
exactly. And we all rely on, connection is the most important thing, and I think that's what's often lost when communication challenges occur. So I think just making small changes to allow people to connect will make a big difference.
Well, thank you, Kate. That's a really interesting conversation.
Thank you.
If anybody wants to get in contact with you, then they can get in contact with you at the University of Southampton. If you put in Google your name, Dr. Kate Howe, and you come up. But also, if people want to contact you through me, I'm more than happy to connect you. So thank you ever so much, Kate.
Thanks so much.